Before we start the formal program, I would like to call to your attention that we have language translation service available in Bengali, Spanish, and Mandarin. If you require these services, please call 212-788-3359, 212-788-3359. So thank you. My name is Jose Pagan. I'm chair of the NYC Health and Hospitals Board of Directors. I want to thank you for joining us and would like to introduce the other board members who are participating. First, I have Frida Wang, Vice Chair of the NYC Health and Hospitals Board of Directors. We have Robert Nolan, City Council Representative for the Bronx. We have Dr. Mitchell Katz, our President and CEO, and Jackie Rowe Adams. I would like to recognize Lorian Valentin, Community Liaison representing the Office of New York City Council Speaker Adrienne Adams, 28th District, and Gina DeFazio, Director of Health and Human Services representing the Office of the Queensborough President Donovan Richards Jr. Also on the panel are Andrea Cohen, Senior Vice President and General Counsel and moderator for the evening, and Colicia Hercules, Secretary of the Corporation. So on behalf of the board, I would like to extend our thanks and acknowledge leadership at our Queens facilities. We have here Helen Arteaga Landaverde at Elmhurst and Neil Moore at Queens. I'd like to thank them and their dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. So now I will turn the microphone to Dr. Mitchell Katz, our President and CEO.
Good evening, everyone. I'm very glad to be here at Elmhurst. It feels historic, right? Given that Elmhurst was the epicenter of the epicenter just about 3 years ago. Hard to believe we've all lived through this together. Unfortunately, we've also lost some people, and we know a number of people who are still suffering from the aftermath of COVID. But it's nice to be in a room where we can have masks optional. It's nice that the number of people in the hospital who are sick with COVID is very small. We've made tremendous progress. Elmhurst and Queens Hospital deserve the people who work there, the nurses who went into the rooms along with the doctors and the social workers, at times not even knowing, what the risks were early on. People bravely went in. They took care of people. They held their hands at the end of life. They connected them with their relatives through iPads. People were heroic. Equally so in making sure that people got the vaccines they needed, the testing they needed. People quickly learned that if you wanted to get a test done and you wanted the result quickly, you didn't go to the private sector, you went to health and hospitals. And I think that whole experience changed how people saw health and hospitals, as it always was. But many people certainly saw a different view. I know at Queens, one gentleman had never been to Queens Hospital, never been to a public hospital, went in, got his vaccination, was so impressed with how well the hospital worked, he left $1 million check for Neil Moore, because people saw another side of what health and hospitals is. We also more recently, just as we were starting to slowly come out of COVID, we were leaders in taking care of people who had Mpox and vaccinating to prevent it. And then the triple pandemics of RSV, along with COVID and flu, we got through that. We're currently taking care of more than 6,000 asylum seekers, part of our tradition as health and hospitals of welcoming immigrants. No place understands immigrants like Queens, the most diverse county in the entire U.S. We're very proud of that. That's our vibrancy, and we're very proud now to take care of people. Despite the pandemic, we did a lot of stuff. NYC Care, which provides care to people without insurance, reached 100,000 members. We housed over 400 people under Housing for Health. We had the #1 ranked skilled nursing facility in the entire state, Seaview. We opened our 3rd Gotham Health Center of Excellence. We expanded Be Heard, which pairs social workers with EMTs to respond to 911 to 10 additional police precincts. We did 15,000 Mpox vaccinations. We opened up our show vans, which go around the city providing care to homeless people through vans. We began to offer plant-based lunches and dinners at our default choice. I spoke with one family over the weekend about the care that their loved one was receiving. And one of the things they told me with great surprise is they said, and she keeps saying how good the food is. When did you ever hear about that from a hospital? But those plant-based meals are actually incredibly tasty. And they're contributing as well to people's overall sense of health. We markedly increased our contributions of contracts to minority and women-owned businesses, more than 3,000. It's another way that we celebrate the diversity of New York City. All of our hospitals are now baby-friendly hospitals. Metro Plus grew to 700,000 members, and our nurses got several important awards across our system. Two of our hospitals were recognized in Queens for the care and prevention of heart attack and stroke. Our 2 hospitals teamed up with Mount Sinai and the Hope Doula program to provide community-based doula support free of charge to any pregnant person seeking care at either of our hospital. I was very proud to be at Queens, where we did with the mayor an opening of the T building, a former tuberculosis hospital, now converted to 200 apartments, 75 supportive housing for people who are experiencing homelessness. Elmhurst now is able to perform robotic-assisted hip and knee replacement procedures after acquiring the most modern robotic equipment. Elmhurst also opened the Mother-Baby Simulation Center to help reduce maternal deaths and life-threatening conditions in patients during childbirth. At Queens, they earned an A on the Leapfrog survey. They were ranked among the 50 most racially inclusive hospitals in America, and they announced plans to build a new outpatient dialysis with $1 million in funding from U.S. Senator Schumer and U.S. Representative Grace Meng, two great supporters of ours. At Gotham, our federally qualified health center provides comprehensive primary care to our families. Our centers are located in Corona, Jamaica, Jackson Heights, Ridgewood, South Queens, Springfield Gardens, and Woodside. We expanded Gotham's dentistry services, and in March, we announced plans to open a new comprehensive community health center in Far Rockaway. Health and Hospitals is filled with the most amazing people you will ever meet. One of them sits in front of me, Dr. Mashapur, 40 years of service to our organization. We are filled with doctors and nurses who could work anywhere but choose to work here because they recognize at the end of the day, it's mission that matters the most. So thank you very much, and I'll turn over the meeting to our General Counsel, Andy Cohen.
Thank you so much. Yes. I'm Andy Cohen, General Counsel, and I'm going to give just a couple of minutes on the rules of the road for the rest of tonight, and we'll be together for a while. So this is the third in a series of 5 meetings conducted annually across the city's 5 boroughs. We've had 2 others so far this year. The purpose of the annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, and also to give, maybe even more importantly, the public an opportunity to present testimony, to speak it, also to submit written testimony concerning New York City Health and Hospitals performance. All of the testimony, oral and written, will be transcribed and forwarded to all the members of our board of directors. As you can see, we have an amazing showing of board members here today, but all those who aren't able to join us tonight will also receive all of the testimony, either transcribed or what you submit. Just a couple of comments about rules of the road. So the most important thing to understand here is that this is, at this point, not a dialogue, but an opportunity for our board to listen to all of you. So you all will come up if you have signed up to speak, make your presentation. Everyone will be listening very carefully, but there won't be a back and forth. There won't be a back and forth, not a dialogue. We're here to listen to you. In order for every speaker to have an opportunity to testify, speakers are allotted 5 minutes of speaking time. You don't have to use all 5 minutes of your speaking time, but of course you are welcome to do so. On the podium is a timer that will provide warnings about the expiration of your time. A yellow light tells you that you have 2 minutes left to go. A red light will tell you that your time has expired, and when it starts to flash, that's when I am going to gently and politely interrupt you and ask you to conclude your remarks, please, as quickly as you can. If you don't finish your comments during that period of time, don't worry, you can submit something in writing, and even tomorrow. You can send it in tomorrow to the office and submit your full comments in writing. So I am gonna, because we have a very robust speakers list this evening, which just goes to the incredible spirit here in Queens, I will be pretty tough about asking people to conclude at 5 minutes. If I mispronounce any names, use your first few seconds of time, and I promise I won't count it against you to correct me and tell us what your name is. I will do my very best. That's it. Thank you so much. What I'm gonna do is I'm gonna announce the speaker and the next speaker. So if you hear your name second, you know that you should be getting ready to go so that you can follow the speaker as quickly as possible. And the mic is right over here on this side. So for those of you on that side in particular, you might want to move over when you hear yourself called after the original speaker. So actually our very first speaker is running late this evening. So we will move right to, and we'll bring her back in, but David Sperry, Chief of Staff of the Office of New York State Assembly Member David Weprin. And then after that, just so you know, is Marina Molina Grisales, the Deputy Chief of Staff for Assembly Member Jessica Gonzalez Rojas. So David Sperry, are you here? And if not, we'll come back to you, but Mariana Molina Grisales, are you here? Is that you? Okay, wonderful. And then after that, Chanel Martinez will be the next speaker. Yes, please, go ahead.
Good evening, everyone. My name is Mariana Molina Grisales, and I am Assemblymember Gonzalez Rojas, Deputy Chief of Staff. Unfortunately, the Assemblymember cannot be here today since she is in Albany working on finalizing the budget that centers public health and immigrant communities. I'm going to share a quick statement from the Assemblymember. I have always said that my district is an institutional desert. I don't have a community center, a hospital, or a senior center. Although Elmhurst Hospital is just outside my district, they have been such a center of support and care for our community and my district in particular. They have been such a lovely partner for our highly requested community paper shredding events, where we have so much fun working alongside Lada and Nancy, special shout out. Sharing resources from Elmhurst Hospital to our community. I just wanna let the Elmhurst Hospital team know how much I value their partnership and their support that they provide every day to our diverse communities. Thank you.
Thank you so much for your comments. Thank you. Chanel Martinez, Deputy District Director for the Office of Council Member Shakar Krishnan. And then after that will be Jack Siegenthaler.
Hi, everybody. Good evening. My name is Chanel Martinez. I'm here from the Office of Councilmember Shaker Krishnan, who represents Jackson Heights and Elmhurst. We are so proud to have Elmhurst Hospital in our district. It is the beating heart of our community. It continues to provide culturally appropriate, affordable, and dignified care to our immigrant communities, our low-income communities, and more to everyone in our district. It represented us during the pandemic and continues to fight for us. We are grateful to have Elmhurst Hospital partner with us in over 10 events. And I'm gonna have to look at my notes because we had so many events with them. But we had, in the last year, had resource fairs with Elmhurst Hospital, mental health forums where we got to discuss the impacts of the pandemic on our mental health and our well-being, events for Ramadan regarding stroke awareness and blood pressure education, paper shredding events. It's a big deal in our Jackson Heights and Elmhurst communities. We had events for iftar as well as immigration legal clinics. We also partnered together for our first inaugural cycle of participatory budgeting, where the community got to elect $180,000 for a new x-ray machine for the pediatric emergency room here in Elmhurst Hospital. We're so excited about that. And similarly, we got to celebrate with Elmhurst Hospital the allocation of $10 million to the front entrance for the renovation for the front entrance and the infectious disease clinic. And we're really excited to help support those initiatives, as well as announcing the renovation of Frank O'Connor across the street, where we know that the staff at Elmhurst Hospital and the patients love to take breaks and get some fresh air. We are so grateful for the partnership of Elmhurst Hospital and the community here, and we urge the board to adopt a fair contract with the nurses here who are frontline workers. Our frontline workers and continue to treat our patients with the utmost care and love, and they deserve the world from us and our deepest gratitude. So thank you all tonight.
Thank you so much for your comments. Next speaker is Jack Siegenthaler, Policy and Budget Director for the Office of New York City Council Majority Whip Sylvina Brooks Powers. And then after that will be Louis Sanctumong.
Good evening, everybody. Good to see you in person, Dr. Katz. I'm Jack Siegenthaler. I'm the Policy and Budget Director for Majority Whip and Council Member Sylvina Brooks Powers, who represents the 31st Council District. I know were she here, she would echo the call of the last speaker in support of the nurses here today and an advocate for a fair contract with the nurses. Her district includes parts of Southeast Queens and the eastern end of the Rockaway Peninsula. First, the Councilwoman sends her gratitude to H&H for their efforts toward opening a new facility in downtown Far Rockaway. Far too many medical needs remain unmet by existing infrastructure in the community. This site will serve many thousands of residents in District 31, and the Councilwoman celebrates the announcement of this facility. While this is an important step forward, she notes too that the Rockaways desperately need a trauma hospital. When a community member in the Rockaways is victimized by trauma, when someone is shot or stabbed or in a major car accident, they may have to travel miles off the peninsula to get the care they need. That's why the Councilwoman formed the Far Rockaway Trauma and Healthcare Access Task Force, which she's proud to co-chair with Dr. Katz. The task force has brought together members of the Rockaway community to assess the needs of the peninsula and explore options for siting a trauma facility. The task force is in the process of surveying hundreds of Rockaway residents, and so far an overwhelming majority have identified trauma care as the most important healthcare service that a new or enhanced facility should provide. So the council member is committed to bringing trauma care to the peninsula. She is deeply grateful to Dr. Katz and to H&H for their partnership. And as she celebrates the announcement of this new facility in Far Rockaway, she notes that there is much work to be done in the Rockaways to ensure community members can obtain care in crisis. Thank you.
Great, thank you so much for your comments. Next speaker, Louis Sanctumong, the CAB chair for Elmhurst, the Community Advisory
Good
Board.
evening, everyone. My name is Louis Sanctumong, and I'm the chairperson of New York City Health and Hospitals Elmhurst Community Advisory Board. I would like to thank the hospital and its staff for the life-saving work they have continued to perform as we move through the end of the COVID-19 pandemic. This evening, I wanted to share with you some statistics that highlight all the hard work the staff of Elmhurst have done over the past year, despite the stresses and strains placed on the hospital daily. For instance, this past year, Elmhurst Hospital has delivered close to 2,000 babies, treated over 130,000 patients in its emergency department, adult, child, and psychiatry, received a gold recognition through the American Heart Association for the Check Change Cholesterol Program, received a national award as a flu seasonal immunization champion. The hospital is also a national leader regarding COVID-19 testing and vaccination. Over the past 3 years, the hospital has provided tests to close to 340,000 people and vaccinated over 135,000 people. The neighborhoods around Elmhurst also have had one of the highest vaccination rates in NYC. The hospital also received a well-deserved honor when it was nationally ranked by US News and World Report this past year as one of America's top hospitals for the treatment of patients in 6 categories: COPD, heart failure, heart attack, kidney failure, diabetes, and stroke. I'm proud of our doctors, nurses, and extended care team who are deeply committed and whose hard work has made these achievements possible. I hope that we can count on New York City Health and Hospitals to support the ongoing quality services that Elmhurst provides to our community. Our CEO, Ms. Helen Ortega, Medical Director, Dr. Jasmine Monsipur, Chief Nursing Officer, John Gould, Chief Operating Medical, Milenka Milinik, and the rest of the hospital leadership and staff are committed to my community, which greatly needs and deserves the outstanding medical care that has been provided to it over the years. Thank you, and I wish you a wonderful evening ahead.
Thank you so much for your comments. I neglected to say who was coming next, Robin Hogans, the Community Advisory Board Chair from Queens, and after that will be Marlene Smith Sotillo.
Good evening, all. My name is Robin Hogans. I am the chair of the Queens Hospital Community Advisory Board. I just want to share with you some of the things that have been happening at Queens Hospital. First, I would like to announce that Queens Hospital has just learned that its intensive care unit received the Gold Level Beacon Award for excellence from the American Association of Critical Care Nurses. We are the only critical care unit within Health and Hospital System to receive an AACN Beacon designation for the second time, as we received the Silver Beacon Award this past December. Our ICU is the second of Queens to receive this designation and the 7th in New York State. Secondly, Queens has acquired designation as an advanced primary stroke center. With regard to the COVID-19, recognizing the 3-year anniversary of COVID-19, the pandemic has been stressful, heartfelt, and uncertain for all of us at many times. Due to our faith and commitment, as we know, there are better days ahead. Queens Hospital has provided over 116,000 vaccinations to date. We still have treatment for COVID-19 is available at our facility. Talk a little bit about the equipment and the infrastructure. Queens Hospital is working on a master plan. Initiative, it will determine what the plan and how our hospital will look over the next 5 to 10 year period. Current projects that are slated to be completed within the next 2 years include replacement of our linear accelerator, renovation and upgrades of our interventional radiology suite, the replacement of the OBGYN ultrasounds, IV pumps, as well as installing a Da Vinci robot in the operating suites. The hospital has taken on projects to also upgrade the patient's room. Let's talk about patient safety and satisfaction. Patient experience is a priority for Queens Hospital. And our continuous improvement efforts, we conduct monthly interdisciplinary HCA-HPS huddles on each of the medical units and with all the staff in those units to review the scores and comments from the patient satisfaction surveys. Our nurse communication top box score increased by 5%, taking us from a 71.3 to a 75.0 in 2022. It is the highest score amongst the H&H acute care facilities. This is just an indicator of the things that are happening at Queens Hospital. Let's talk a little bit about patient experience. Several of the CAB members are patients at Queens Hospital. Therefore, Patient Care Committee always monitors the deliverance of services throughout the hospital. We represent the community, and it is important to us that our inpatients, outpatients, and our networking communities are treated well. And we also deal with the issues and the concerns appropriately. We have improved wayfinding in an attempt of including patients and community members into our projects as part of our commitment for the plant tree concept of patient-centered care. As part of this endeavor, all staffs will be engaging in empathy training to improve communications and overall attitude. We continue to reinforce the ICARE principles of integrity, compassion, accountability, respect, and excellence. And managers are asked to provide real feedback to employees, both positive and negative. Our accomplishments, just a brief snippet of our accomplishments. We are one of the 4 of New York City Health and Hospitals ranks among the 50 most racially inclusive hospitals in America by the 2021 Lowen Institute Hospital Index for Social Responsibility. And we received that ranking being number 14 out of 2,800 hospitals. Queens Hospital received a Leapfrog Hospital Patient Safety grade score of A for the spring and the fall of 2022. We received designation as a leader in the LGBTQ+ healthcare equality for 2022.
I'm going to ask you just to summarize your last sentence and hand in these wonderful accomplishments.
Okay, well, just a little bit more to go, but just to thank you for hearing me out, to understand the accomplishments, the hard work that the staff puts forward at Queens Hospital, and the CAB. We are totally immersed in making sure that Queens is the best that it can be. Thank you.
Wonderful. Thank you so much. Thank you. I want to recognize that we had 2 speakers from the Elmhurst CAB, Raj Punjabi and Aida Gonzalez-Jaron, who submitted testimony instead of speaking this evening, but thank you for the testimony. We do have it. Next speaker is Merlin Smith Sotillo, a Community Advisory Board member from Queens, and after that will be Tiziana Nin. Thank you. Go right ahead.
Good afternoon, everybody. My name is Merlin Smith Sotillo. I'm a member of the Community Advisory Board at New York Hospital, and I'm also the president and CEO of the Sickle Cell Awareness Foundation Coop International. Tonight, I'm going to talk about sickle cell disease, its prevalence in the Southeast community, served by Queens Hospital, and the advancement being made to address this disease. The fact is that no other disease better exemplifies the effect of racism in healthcare than sickle cell disease. We all have intuitive understanding of what that means. But the actual data is heartbreaking. While the mortality rate for children is decreasing, the overall mortality rate for sickle cell disease is increasing, with young adults having the highest rate. These healthcare inequities are simply unjust and reflects the lower priority given to sickle cell disease as compared to other chronic disease highest rate. The Sickle Cell Awareness Foundation, one of the premier sickle cell organizations in New York City, and which I represent, is thrilled to continue our partnership with Queens Hospital to address these inequities. The partnership we share with Queens Hospital includes our fervent support of Queens Hospital Comprehensive Sickle Cell Program that provides the best of care for individuals and their families affected by sickle cell disease across their lifespan. Together, we are dedicated to eliminating disparities in care for this debilitating illness. Going forward, our plans are to partner with Queen's Hospital on their grant for the Federal Health and Human Services Office of Minority Health to increase the use of hydroxyurea in children from 9 months to 21 years of age with certain genetic conditions specific to sickle cell. The use of hydroxyurea dramatically improves outcomes and quality of life, yet is underutilized in children. To change this, the grant supports a shared mental model of the importance of hydroxyurea between the emergency department providers, pediatric hematology, the sickle cell community-based organization. We all support individuals and family decision about the disease modification drug through education and support groups. In addition, Queen Hospital are working both with American Society of Hematology, Sickle Cell Disease Learning Collaboration, and HRA Sickle Cell Treatment Demonstration Program, Quality Improvement Initiative. We are eager to begin working with them in eliminating disparities of care and decreasing the stigma individuals with sickle cell disease face when presented in the ER in pain. Lastly, the Queen's Hospital will be providing us with grant funding to help support our advocacy and community outreach, education, and efforts. In closing, I would like to announce that the Sickle Cell Foundation will be hosting a Sickle Cell Symposium on Friday, April 28th, from 9 a.m. to 3 p.m. from Queen's Hospital Center Auditorium in Jamaica. The topic will be advances in treatment for sickle cell disease and will feature various specialists in treatment of this condition, including Linda Ballone, Research Nurse Manager of Queens, who will speak about sickle cell disease research. This event is co-sponsored by the New York State Senator Saunders and the New York Council Speaker, Adrian Adams. And anyone who has the form, if you can please fill it out and return it, and because you have to register, I really would appreciate it. Thank you kindly for.
Thank you so much for your comments. The next speaker is Tiziana Nin, the Community Coordinator for the Mayor's Office to End Domestic and Gender-Based Violence. And after that is Jessica Nugent.
Hi, good evening, everyone. Thank you for allowing me to speak. Thank you to all the health providers, healthcare providers that work during COVID and continue to do amazing work. The pandemic was really rough, and I want to talk about something we call the silent pandemic that happened. There was an increase in domestic violence during that time that continues consistently in New York City. So I would like to discuss our resources. We have the Family Justice Centers, and there's one in each borough. They offer free and confidential services to anybody who's been affected by intimate partner violence, family violence, sexual assault, human sex trafficking, and elder abuse. They're open Monday through Friday, 9 to 5. You do not need an appointment. So I know health service providers often come across victims of such atrocities like domestic violence, human sex trafficking. Our Family Justice Centers don't need appointments. You can send them to us as soon as you're done with them, helping them and servicing them in the ways that they need, and we will work with them on a hybrid level or in person. And I just wanted to share that. We also have workshops and trainings for medical professionals, so if you're interested and you'd like one, we offer that, and for community as well. And I will leave resources at the table on my way out. Thank you.
Thanks so much for your comments. Next speaker is Jessica Nugent, an NYPD detective, and after that is Menbeer Singh.
Hello, everyone, and thank you for inviting us. My partner over here, I just want to say thank you to Elmhurst for being a partner, for being a friend, for being there every time we need them. We have a lot of programs where the hospital is there to help us. With the 5K run with the community, the hospital is always there, helping out with the community, talking to the community about health. We also have book bag giveaway. Elmhurst, again, They're helping us. We have the Explorer program, Kids in Our Community. We got the hospital provide CPR training for them. So the kids learn that day what to do in case of an emergency. So many things that the hospital has helped us. Atia, thank you so much. I want to say thank you. Every time I call her, I go, Atia, we're doing, the book bag or their 5K run, the Girls Talk, which is our mentoring program for girls in the community. She's there to help us to say, okay, I'm gonna get a psychologist to talk to your girls. Or thank you, and I appreciate it. And we're here as well. Call me and we'll set up something. If you want us to talk to the community in Spanish, which that's my main language, but I'm always here to support. And I love this hospital. Thank you so much.
Thank you. Thanks for your comments. Next speaker is Menbeer Singh, Director of Government Relations and Strategic Partnerships at Metro Plus, and then it will be Mary Madden.
Good evening. Marvin is not able to join us today, so my name is Gabriela Mayorga. I'm here on behalf of the Brand X team for Metro Plus Health, and I'm very happy to be here. Thank you, Dr. Katz and the H&H Board for the opportunity to speak about our work with our H&H facilities here in Queens. While Metro Plus has a presence in the 5 boroughs, we are proud of the work that we do with H&H in Queens, especially with our strongest partnership with H&H Elmhurst Hospital, where we provide 7 sales representatives on site conducting enrollments, as well as customer success concierge representative who assist our members. When the weather permits, we have our own thing going on outside in the H&H entrance by the 41st Avenue, where we just put a tent and we provide access to healthcare. We are also proud of the joint collaboration that we have been able to create with the Departments of External Affairs, ATIA, Community Outreach, with Clara and Nancy, and our Rochelle Ramos, where we have created these partnerships with other organizations like the Museum of Queens, Common Point, and we take these services to the community. We not only provide access to healthcare, but we also give access to holistic services, art programs, food pantry services, job readiness, free taxi services, WIC and SNAP. We come in a package, so that's what we do. And creating this experience to our community allows them to have an H&H experience that provide access to health, community, and social services that can improve the health quality of our communities. Thank you.
Thank you so much for your comments. Next speaker is Mary Madden, nurse practitioner here at Elmhurst, I believe, from NISNA. And after that is Doris Gabriela Mayorga. Oh, I'm sorry. Okay. So after that, thank you. My apologies, would be Anthony Coop.
Good evening. My name is Mary Catherine Madden. I'm the nurse practitioner here at Elmhurst for the past 24 years for the breast service, and I'm also an NYSNA member. It has been brought to our attention that the Health and Hospitals is concerned about how many weekends nurses work and when we resign from our positions. And those concerns are weighted by the fact that we're down over 2,000 nurses. So when we have parity in our salaries, then we won't have to be worried about how many weekends we have nurses working and when we decide to resign from our positions, because we'll have enough nurses and the staffing will then be levied. Secondly, I'd like to talk about nurse practitioners, and I've mentioned this before, and administrative time. So here at Elmhurst Hospital, the medical staff is from Mount Sinai Services, and within their contract, they have administrative time. And NYSNA member nurse practitioners here at Elmhurst have been told that they do not get administrative time because it's not in our contract. Now, whether or not it's in our contract, we still have administrative work to do, and we need administrative time to do that. And there have been times when people supervisors have said to nurse practitioners, well, you can do it in between patients, you can do it before, you can do it after. But Dr. Katz, you know what that's like. You have to look up your report, you have to get an interpreter on the phone, you have to make that phone call, you have to call, I call 3 times. I call 3 times because what I think is, well, the first time they think it's not for me. The second time they think, maybe it's still not for me. And the third time they think, oh, wait, maybe that person really is trying to get me. So all of that takes time. And the idea that you're going to slip that in the 20 minutes before you start your first patient or after you have a no-show and you're really going to tackle that to-do list is just not realistic. We really need a block of time to do administrative work, just like the physicians get. Thank you very much.
Thanks for your comments. Next speaker is Anthony Coop, Green Market Regional Manager for Grow NYC, and after that is Jim Burke.
Hello all, my name is Anthony Kuo. Thanks for having me tonight and allowing me to speak. I am, as Andrea said, I am the regional manager for the Elmhurst Hospital Green Market, and it is one of 50 or 40 something green markets that we run in the city. I have had the pleasure of being at market and seeing how things run. And I'm excited to announce that we are expecting to come back on June 13th. It's Tuesday. And our last day is expected to be November 21st. You can expect us to set up in our usual spot on 41st between 80th and 81st every Tuesday other than Election Day. And you can expect 3 producers, a vegetable producer, a fruit orchard, and a bakery. Let's see. In addition, as with years before, folks with SNAP benefits, EBT, pandemic EBT, if anyone still has that, are able to use their benefits at market. And we also have partnerships with Health First and Humana. So members with select plan members with OTC cards are now able to use those benefits at market as well and be able to buy healthy foods. We also, the farmers accept WIC and senior farmers market nutrition program checks. And as always, the farmers will take cash as well. Moving on to our partnership with the hospital, though, we are super thankful to have the space to be able to set up at market right outside the hospital. I mean, for us, our mission really is to allow New Yorkers to access fresh, healthy, local, nutritious food and to allow farmers to sell in New York City as a way to preserve farmland in the region. But if we zoom out a little bit, like the hospital, it's not just about like immediate medical care, right? Like there is, I think, a focus on wellness and health. And so the fact that we are able to set up and market right outside the hospital, I think speaks a lot to the effort that the hospitals and Elmhurst in specific is delivering on. And I can't imagine like a better place to set up a market than right outside a hospital where patients can go, get some advice, get instructions, and then walk outside and be able to buy healthy food. So before I yield my time, I'd like to thank Atia Butler and the external affairs and marketing team for being incredibly supportive of the market, including us in initiatives and events when appropriate. It's been a pleasure to work with you all and hope to see you all at market this year when we open. Thank you.
Thank you so much for your comments. Next speaker is Jim Burke, co-founder of 34th Avenue Open Streets Coalition. And after that will be Danny Forum, NYPD detective.
So my name is Jim Burke. I love Elmhurst Hospital for both professional and for personal reasons. I work with them with the coalition, with Clara, Nancy, IT. I can't thank enough for all the amazing events we've had on 34th Avenue. I'm also a consultant for the 82nd Street Partnership. Again, they have stepped up and done wonderful things. One of my favorite is the healthy food demonstration. But on 34th Avenue, they've done the doctor's walk with us. They actually helped us do beautiful plantings and gardening with the children of 34th Avenue. And then I'm also a board member of AFI, Asians Americans for Equality, and they came to our beautiful Three Kings celebration. And then personally, I had COVID followed by a major heart attack on the street. And I came here and basically you guys saved my life. And I'm so grateful. The staff who treated me in the emergency room came up and, yes, checked up on me upstairs after my surgery, which I thought was very, very sweet. And I'm just grateful for you on so many levels, and grateful for the amazing staff that you have here. So thank you.
Thank you for your comments. Glad you're well. Our next speaker is Danny Forum, an NYPD detective, followed by Natasha Fulton. Let's see, do we have Danny Forum? Was he was with, okay. He was with the other detective, thank you. Okay, so great, Natasha Fulton and then Ahmed Hassan.
Hello, everyone. My name is Natasha Fulton. I'm the Vice President of Canberra Supportive Housing for Brooklyn, Staten Island, and Queens. So I'm just going to give you a little summary about Canberra. Canberra is a community of staff, volunteers, clients, donors, neighbors, and partners who work together to build an exclusive New York City where all children and adults have access to resources and support that they thrive to have. Currently, Health and Hospitals have put in money with Dunn Development to create the T Building. The T Building is located in Jamaica, New York, Queens. It has over 200 apartments with 75 units designated to chronically homeless tenants who were previously in the shelter and have a mental illness. They're connected to case management, and currently we have over 80% of our tenants enrolled in PCP at Queens Hospital, as well as the other 25% coming to Elmhurst Hospital. We have 45% of our tenants are working, while the remaining tenants receive the actual benefits of SSI or public assistance. We have 85% of our tenants enrolled in mental health services between Queens Hospital and Elmhurst Hospital, and we are greatly thankful for the connection that we have gained with Health and Hospitals. Thank you.
Thank you so much for your comments. The next speaker is Ahmed Hassan, the LBU president for NISNA at Elmhurst. And after that is Assembly Member Stephen Raga.
Good evening to you, Dr. Katz, your team, Board of Directors, and the general public. My name is Ahmed Hassan. I'm a staff nurse working in the psychiatric department for almost 7 years now. I'm also the chair of the labor bargaining unit of this hospital, with NASNA, New York State Nurse Association of this facility. On behalf of our union, I would like to welcome you all to Elmhurst Hospital Center. This is the facility which was referred to as the epicenter of the COVID-19 pandemic. Elmhurst Hospital Center has been providing excellent healthcare services to the general public for 190 years. We have dedicated staff who always rise to the occasion despite any challenges we might face. I personally chose to become a registered nurse so that I can provide a compassionate and patient-centered care to all my patients regardless of their circumstances, especially the very vulnerable ones in our society. Despite all that took place here and made headlines across the globe, we came together and stood strong, helping one another and ultimately overcoming our most difficult challenges while providing excellent care to New Yorkers and beyond. We are always, as we call ourselves, Elmhurst Strong. All the same, the pandemic hit home so bad. We lost loved ones, we lost colleagues, as well as family members of colleagues. But at the same time, I believe one thing that this pandemic taught us all is resilience and the need to prepare for any unforeseeable challenges. In spite of what we endured as healthcare staff during this dark period, we are hearing that we may lose some aspect of our own healthcare benefits when we retire. And the question that comes to mind is why? These are some of the reasons why we have gathered here this evening to let our collective voices be heard about our concerns and the need to advocate for a fair contract so that we can continue to provide the best care to the public. Right now, we are facing serious staffing issues across our great institution, which is H&H, for two main reasons. The first one being that most of our senior members are retiring. And secondly, there's a lack of incentive, which doesn't allow for retention of the new members that are hired, since we cannot compete with the private institutions. And here in Emma Center, we are not an exception. As we continue to negotiate our contract with the city, we want to make it clear to all leaders that safety net facility nurses deserve better, just as our colleagues from the private sector. And it is about time we receive parity in wages. Ultimately, everything we are asking for in our contract is meant for the safety and survival of our patients, our community, and the general public. We will continue to put our best effort in providing excellent care to all of our patients, regardless of their socioeconomic status, as always. But in order to be able to fulfill this promise, we are asking for a fair contract that will afford us with the resources that we need. Thank you again, Dr. Katz and your team, for visiting us today and making this important meeting a rarity. We believe in you, and we also believe that we can count on your leadership on this matter. Thank you so much.
For your comments. Thank you. The next speaker is New York State Assembly Member Stephen Raga from District 30.
Good evening, everyone. My name is Dalma Lama. I'm here on behalf of Assembly Member Stephen Raga, District 30. We cover a good chunk of Elmhurst, Maspeth, Woodside, Sunnyside, Astoria. And it is our pleasure to be here, actually. Thank you so much, NY Health and Hospitals, for inviting us. This has been said throughout the program that Elmhurst Hospital has been through so much, and yet we are standing here so strong. And let's give it up for Elmhurst Hospital, y'all. I want to give it up for Nurses Association. Let's give the energy. As you may all know, Assembly Member Stephen Raga had been there on the streets when Nurses Association were striking, basically. And he was there in the rally. We were supportive, and we're still supportive for the safer conditions of the frontline workers that we have in the room and outside in the community. We're very supportive of that. Something that I wanted to highlight is although we are a new office, in our first 3 months, we have about 300 plus cases that were worked on, and a lot of them are from Elmhurst. We have a lot of the seniors that come to our office, and they say they have told us, our office, about how a lot of the hassle they have to go through regarding any government programs they have to go through. And our office has helped. We're very proud to announce about the 300 cases we have ongoing and also past. We have already completed many of them. So thank you all for inviting us for this event, this annual event. We stand in solidarity with the nurses, the frontline workers, and with the Elmhurst Hospital. Thank you so much.
Thank you so much for your comments. The next speaker is Natalie Rubio, the CEO of Voces Latinas Corporation. But after that is Maria Diakis. Again, please correct my pronunciation.
Good evening, everybody. Thank you so much for allowing us the space to be able to hear us. I'm Natalie Rubio Torre. I'm CEO and founder of Voces Latinas in Jackson Heights. We're a 20-year-old nonprofit agency serving the most vulnerable of Latinos in our community, including our undocumented. So Elmhurst Hospital is key for us. But before I begin, I just want to say personally thank you to our nurses, because you not only saved many of our clients, but you saved our staff who's sitting here that were hospitalized. So thank you so much. So I want to just be able to highlight some of the wonderful work that we've been able to do with Elmhurst Hospital, but I also want to highlight where we can do a little bit better. And I always believe that there's always room for improvement. So from our inception, we've been having so many partnerships with health and hospitals, from recently with COVID to NYC Care, and also with Thrive. Communities Thrive, which is a mental health component, a partnership between the mayor's office and H&H, which is coming to an end in December. That is something that we will be talking about and advocating for, to see how we can continue that program, because it serves so many of our most affected population with mental health services, both urgent care and non-urgent care. So there's a lot more to come. We were just told last week that it's coming to an end. But I also want to say that most recently, we've been able to partner with Global Health, with Dr. Salama and Global Health. This partnership has been amazing for our communities, because we've been able to talk about openly and share and address social determinants of health of our community. We've been able to place residents from the hospital over to Voces Latinas, so that residents that are coming into this field and serving our diverse community could get a lens in from the community. But also we're talking about placing Voces Latinas Promotoras, which are community healthcare workers, into the hospital, so that we could exchange those lenses and get some perspective from inside the healthcare system, but also from the community. And I think these kinds of partnerships really highlight and improve community relationships with our healthcare system. This came as a result of our partnership with Dr. Salama in our Global Health. As a result of this work, we've also been able to apply for an NIH grant, where we put Elmhurst Hospital in as the partner. If we get this grant, it's an opportunity to do a 10-year study on, again, addressing social determinants of health, using the Elmhurst Hospital, but also with the Voces Latinas culturally responsive interventions. And I think a collaboration like that will be not only in a research study, will be very, very enlightening. I'm also here representing the Communities Together for Health Equity. It's a coalition supported by Arthur Ashe Institute, and we are made up of over 70 community-based agencies all over New York City, including Staten Island. And I'm proud to say that through our Global Health partnership, we've been able to present to providers here one morning, including the social workers, on the wonderful groundwork that we've been able to do after the pandemic, and addressing and really hearing from the community how COVID has affected them, how they've been able to cope, and some of the resources available, but also resources that we still need. I'm hoping that through this work, we're able to do more of these, because what we found was that providers are not talking enough with community-based agencies. Community-based agencies need to feel that we have a seat at the table with healthcare. We are the ones who bring in the patients. We are sharing clients. We call them clients, we call them patients, but we're sharing. Community-based agencies like Voces Latinas, we walk people over, we accompany, we translate. So we have to be involved in this and need to have that seat at the table to also hear from our perspective. But things that we could improve. So I really feel that, pandemic, no pandemic, insured, non-insured, we need to have that respect, that professionalism, and provide our services with our clients with dignity. Whether you're a homeless person accessing the emergency room, or whether you're coming with $1 million donation, we need to feel that our clients are being treated with the utmost respect and with provided dignified services. It's not always like that in the emergency room. And I have to tell you, my own staff has experienced it. My staff, some of them living with HIV, their confidentiality has been violated. Our homeless clients are not treated with respect, are expressively being told, not again, we don't want to see you, get undressed in front of our other case managers. We have to, I understand it's a lot of pressure, but this is what's happening. And I think this is the time for you to hear exactly what we're experiencing. I know my time is running out, but I had to, this is something that is going on and we really need to have some improvements. But I thank you again for your time, and we are here for any other recommendations or any future work. And again, Communities Thrive, please, let's talk about it.
Thanks for your comments. If you have anything that you weren't able to get to, please submit it in writing. We're happy to take it in writing if there was anything you didn't get to. Our next speaker is Maria Diakis, a program assistant with Elmhurst Community Partnership. And after that, we will go to Ray Briggs.
Thank you. Good evening, everyone. My name is Maria Diakis, Director of the Elmhurst Community Partnership. We are a coalition of about 50 to 60 community-based organizations and other stakeholders that work with communities here in Elmhurst, Corona, and Jackson Heights. First and foremost, I want to thank the Elmhurst Hospital for always understanding the importance of collaboration and partnership when talking about supporting our communities. We are represented, and the Elmhurst Hospital is represented by Clara Londoño and Nancy Polo. We want to extend our gratitude for sponsoring a lot of our events in the past, like our Women's Empowerment Dinner, that has an underlying focus on bringing awareness about domestic violence in our community. We've had several nutrition workshops and so much more. And it speaks to the fact that you all understand that there's other things that determine health in our community, and those need to be focused and come at the forefront. We are also really happy to announce that in the coming year, we will be opening up a community center in the heart of Elmhurst. And we are really excited to see how the Elmhurst Hospital will leave its footprint with us, conversations pending. So thank you so much.
Thanks for your comments. The next speaker is Ray Briggs. Nice.
Good afternoon. My name is Ray Briggs from South Brooklyn Health, and I'm extraordinarily pleased with the amount of work that our sister organizations are doing. That's Elmhurst and Queens. Extraordinary. And why is extraordinary? Because we have extraordinary nurses in H&H. And most people got up here to talk about relentless praises on the achievements of H&H, but the suffering of the nurses and the degradation of their profession has not been mentioned and not been felt, because it's something that you have to see and you have to witness. Being on the negotiation team, I can tell you that looking across the board at the city negotiation panel, it is not clear whether or not they favor the nurses or they favor just the fact that the politicians can get up there and talk about improving the infrastructure and improving the healthcare system in New York City. It is sad. We should not be going through this negotiation thinking that nurses are second-class citizens. We have immigrants, we take care of immigrants, and as we guys are taking care of immigrants, we can take care of our nurses, especially bedside nurses. And I've been a bedside nurse for 27 years and being a combat vet in terms of more than one time, being in the military, where you have to give care under fire. I know what it is to have a heart in healthcare. Nobody can tell me that I'm not qualified to speak, because I'm speaking from different platforms. Now, in terms of parity and in terms of taking care of our nurses' safety, parity pay is the gist of it. The mayor got up and talked about the increase in suicide rate among teenage girls, which is on the increase. That is something in terms of the domestic violence. That is something that goes hand in hand, knowing that we have a hefty population of female nurses. Women, we're talking about, life is at stake here. We finished slavery. Are we imprisoning or are we enslaving our women? You answer for yourself if you don't give the nurses a fair contract. And I'm going to just leave it there and leave it to your conscience to say that the nurses need to know whether they should stay or go. That's the bottom line. You can build all the infrastructure you want. You can talk all the elaborate plans you want. The nurses need to know right here and now whether they should stay or they should go. Thank you.
The next speaker is Petra Lovric, also from NISNA. Yeah, sorry, Petra Lovic, yes. And I'm sorry, the next, and the speaker after that, I apologize, is Delano Hug.
So my name is Peter Lovric.
Peter, I'm
Yes,
sorry.
I don't know why it was said Petra. One of the nurses here in the pediatric emergency room. I've lived here for about 30 years. You know, Ray Briggs spoke about whether we should go or we should stay. I chose to stay, right? I've been here for 7 years. I was initially hired at a private institution, but I wanted to give back to my community, the place where I live, the place now where I work. And I'd like to thank Dr. Katz and his support for our contract. I think that should be highlighted. He has been public in stating he supports us. However, I'd also like to bring up that last negotiation, Dr. Sineas brought up 2 clauses, both did not seem to support us. One was that this is true for everyone in the room. One was that we let H&H know 4 weeks in advance if we were to leave. This was an actual proposal brought forth by our chief nursing executive. The second was to make up missed weekends if we were off vacation or sick, what have you. These were the proposals brought forth. So while I agree with you in public, I appreciate your statements. I think there's clearly miscommunication amongst the upper echelon of H&H. This has to be communicated better. If you support us, you as a whole need to support us. And we can't have this miscommunication and frankly obliviousness to our struggles as nursing. We've watched entire orientations of nurses leave, 20, 30 at a time, right? I've done 16, 17 and a half hour shifts, right? I can't formally put that in because 16 is the max. So I've worked an hour and a half for free to save a 3-year-old's life. I should not do that. And it's because there is no other senior staff. Everyone is leaving. So we need to know, as Ray Briggs said, whether we can stay or we can go, and we have to know before June 1st. That's our deadline. And just to note, we're not asking for hundreds of thousands of dollars, what they're paying agency staff, probably upwards of hundreds of $1 million per year. And this is the truth, right? We're in a budget shortfall of $150 million, partly because of that. And yet, every second that we delay on this contract, we're losing more and more money. So I'd like to propose to you, Dr. Katz, formally, if we can have the real figures, since we've been asking since last year for these, how much are we paying actual agency staff per year? We know only of Jacoby so far, and that's not fair. That's not fair as a taxpayer either, and I think everyone here as a taxpayer has a right to know as well. So I'd like to propose that to you, that we, the union, receive these figures. Secondly, it's not just the cost of agency staff, it's the cost of training as well. $25,000 and $45,000 per nurse. Sometimes we have 2 nurses leaving a single vacant position within a year. That's $50,000 walking out that door, right? That's a lot of money. It saves you money to sign the contract. I don't understand how we're still waiting. I genuinely don't. So I'd like to thank you and your support in public, but we really need to communicate better. Thank you very much.
Your comments. The next speaker is Delano Hug, also a NISNA member, and after that, Chandra Chakravarti.
Good evening, everyone. So my name is Delano Hug. I've worked at Elmhurst for over 10 years, and I've worked in the emergency room for the past 6. My personal story has to do with during the pandemic. I would say me and one of my staff member, we was a staff member called out, so we were stuck taking care of 60 patients in the B room, and I must say that was one of the most painful shifts I've ever had at Elmhurst. When I went home and I sat and I spoke to my wife, I honestly thought about quitting. And I think one of the things that really got me to come back to work and have been working here since is just the fact that I know that my coworkers actually that I work with every day has my back. And So my portion of this whole thing is to really address the short staffing and why it's so important to us. I know the emergency room have a high influx of people, and it's really the gateway to the hospital where everybody comes before they're shipped off into inpatient. And, you know, as a nurse working in the emergency room, it's very stressful, but there's also a lot of things that we learned. And I have learned that sometimes it's not just giving the care, but it's just the time that we need. And as much as we may have all these patients at times, it's very difficult on our mental health, I must say, because, you know, after, as we said, sometimes we do 16 hours shift, you know, and covering people who call in out and don't show up, it's extremely difficult. And as I sit here, as I stand here and I'm talking to you guys, what I need from you guys is just support that these nurses need in order to do a better job and service the community. Because sometimes it's very hard when we give our all and these patients are not satisfied with the quality of the care. And it's understandable because I have been a patient here and I was somewhat not satisfied with the care, but I understand sometimes it can be overwhelming being a nurse here. And it's important that we do get good nurses and quality nurses with care. And it's just retention, you know? We really need nurses to stay and they need incentives. For me, it's not about the money. It's really not. It's really just coming to work every day, making a difference in someone's life and actually making them feel better when they leave here. You know? Thank you.
Thanks for your comments. The next speaker is Chandra Chakraverty from RX Pharma. And after that, Brendan Cohen.
Hi, my name is Chandra Chakraborty and I work in Rikers Island for 30 years. And I just want to say my patient, I went to the pharmacy. My patients are coming to the Elmhurst and they are very happy when they come back. They said it's the Elmhurst Hospital taking care good, nurses, doctors, pharmacists, everybody. And I'm appreciating you guys, what you do for my patients. That's what I want to say.
Thank you very much. Thank you for your comments. Next speaker is Brendan Cohen, also from NISNA, and after that, Peter Pacheco. Okay, since if Brendan's not here, Peter Pacheco.
Okay. Hi, everybody, and thank you for listening. I am a New York State Nurses Association delegate. I'm on the bargaining unit. I've been a bedside nurse for 34 years, first in Denmark, where I got my training, and for the last 21 years with Health and Hospital. And I'm very proud to be working with such kick-ass nurses that we have here. From Elmhurst, I represent long-term care. I work at Carter Hospital. We used to be Goldwater Hospital on Roosevelt Island, but now we're there. I'm tired. Today was another day where we were short-staffed. I had 10 ventilator patients. These are patients that need to be monitored closely. They need to be suctioned every 2 hours. I have been medicating nonstop from 9 o'clock to 3:30 and knocked in some documentation after that. And I'll have to do the rest tomorrow because I wanted to come here. As you've heard, our contract demand is parity. We need to be paid the same as the nurses in the private sector. Otherwise, we cannot retain our nurses, and then H&H is in big trouble because you cannot run a hospital without nurses, right? So, as you also heard, after the session before the last session where the city came back with these two proposals, which were kind of ridiculous, this was after we had given 5 hours of, at times, very emotional testimonies about how it is to work understaffed all the time, which ended with city-side negotiation giving us a standing ovation. Nice. But after that, we got these two proposals, work an extra weekend to make up if you're sick or if you're on vacation, and give 4 days notice. When I came back to my facility at Carter and told them that, that's not me, but I have to convey the message, they said bullshit. My own words would have been a lot stronger. Okay? So, why are we not there yet? To say that the richest city in the world cannot afford to pay its city nurses is ridiculous. And it's not true. It's a choice. It is the choice the city administration with the mayor is making. And you have to wonder why that is. Is it because the majority of the people we take care of are undocumented, people of color, working class, working poor, underinsured? I do not believe as a nurse that my neighbor does not deserve as good health care as I have, or vice versa. That is intolerable to most nurses, I'm sure. Also, just to share, somebody was mentioning retiree healthcare benefits before, and this was a thing that was brought up in our first negotiation, that the city is very concerned about containing healthcare costs. If they really were concerned about healthcare costs and containing it for the city workers, they would be pushing a universal system, a single-payer system like the New York Health Act, which they're not doing. They're pushing everybody into so-called Medicare Advantage, which by the former communications director of one of the biggest insurance companies, Cigna, is called the biggest heist, the biggest fraud, the biggest transfer of money from the public to private shareholders. This is ridiculous. So, two things. As you heard, we've set a deadline for June 1st. We need to have a contract, otherwise we have to get extremely loud. Another thing is this cannot just be New York State Nurses Association's fight. This has to be all of New York's fight, because this is ultimately a fight to keep health and hospital viable.
I'm going to ask you to conclude your remarks.
So the last thing I want to say is that on May 10, we don't have any flyers yet, but May 10 at 11:30, Union Square, we are going to have a big rally. We need everybody to come. Bring your families. If you want to keep health and hospitals and you want to keep your senior nurses in health and hospitals, you need to come and support us.
Thank you. Thanks for your comments. The next speaker is Franklin Acapina, Research Assistant at the New York Hall of Science. And after that, Brendan Levy, Business Development Manager at the Queens Chamber of Commerce.
Good evening, everyone. My name is Franklin Acapina. I'm a local community member and a resident of Jackson Heights. I received primary care from Elmhurst Hospital as a child, and I still do to this day. I want to shout out to the amazing work that the nurses do and all the professionals here. And I have friends and family who still receive services at Elmhurst Hospital. I'm also an employee at the New York Hall of Science, which is a science museum in Corona, just a few minutes away from here. And during these remarks, I will refer to the New York Hall of Science as NYSCI. Today, I wanted to share about how Elmhurst Hospital has been a valuable community partner to cultural institutions like NYSCI. Last March, Helen Arteaga Landaverde, the CEO of Elmhurst Hospital, spoke at the Queens College Black, Latinx, and Caribbean Students Day celebration. She spoke about the impact of the COVID-19 pandemic on communities of color. One of the things we know about COVID-19 is how hard our community in particular was hit for a variety of reasons. But we also know that Elmhurst Hospital served community members to the best of its ability and continues to improve and build its capacity. Thinking back to Helen's remarks at the Queens College event, she ended her speech with recommendations for action, one of which was partnerships for workforce development. One of the ways that Elmhurst Hospital has continued to build capacity and actualize this recommendation is by supporting COVID recovery efforts in the community with museums like NYSCI and other community-based organizations. NYSCI received a grant from the NIH focused on exploring public health careers specifically with Black and Latino youth. Working with ELMCOR, a local community-based organization I'm sure many of you might know of, we are doing this by better understanding why COVID-19 impacted our community in the way it did and how COVID brought to the forefront the disparate health outcomes Black and Latino populations face in comparison to other populations. COVID really taught us that culturally responsive health interventions are the way forward in meeting the needs of diverse, vibrant communities like ours. So we need a public health workforce that is representative of the communities we aim to serve. As part of this project, we have a number of wonderful healthcare professionals from Elmhurst Hospital who have advised us as well as supported us, specifically with the Elmhurst Hospital Community Engagement Team. We spent about 18 months in the community conducting a needs assessment where we talked to community members of all ages about their experiences living through the pandemic. And we also brought together community members with experts in the public health field, including folks from Elmhurst Hospital, as well as other medical and public health agencies to have a dialogue about how we could work together to mitigate these disparate outcomes in the future by challenging traditional ideas of what a career in public health is and who has access to those career paths. Rather than continue to bore you with why we think it's important to activate young people's interests in the broad range of public health careers available to them, we would like to share some reflections from high school and college students we work with in this project about what they're learning. One student said, "I found it eye-opening realizing all the social and health disparities that exist. It really helped me realize how lucky I am and how prevalent these issues are. I am now more concerned about public health," another student says. For example, we did an assignment where you have to walk around your neighborhood and observe the health resources available. I have walked around there so many times, but I've never observed it that way. Lastly, a student said that one of the most important things I have learned is how different environmental factors can impact the health of people in a community, such as transportation, education, and what we can do to combat them. In summary, we hope this provides you with a picture of how collaborations between public hospitals, like Elmhurst, and cultural institutions can benefit the community, and that we should continue to provide funding as well as other kinds of support for initiatives that will help to diversify the public health workforce through authentic engagement with community youth. Thank you very much.
Thank you for your comments. Thanks very much. Brendan Levy from the Business Development Manager from the Queens Chamber of Commerce. And after that, Rachel Kellner. Okay. All right. Rachel Kellner, owner of Anye Chocolates. Tell us the right way. Thanks.
Hello, everybody. My name is Rachel Kellner, and I am the owner of Eigner Chocolates, Elmhurst Hospital's chocolate of choice. Just to let you know, chocolate shop of choice. Thank you to Helen. So I just want to share a little bit about how Eigner Chocolates and Elmhurst came to know one another. It's kind of an unusual partnership. So 3 years ago, we were in our showroom and we had produced everything that we needed to for Easter, and then New York City shut down. And I found out through a customer of ours that there was another customer of Eigner's who was the emergency room doctor here at Elmhurst Hospital, Suzanne Bentley. So what we decided to do, for those of you that know, everyone was going on rainbow hunts during the pandemic because it was the safest thing to do. So we decided to create a rainbow bunny exchange. And we asked children in the community to draw pictures of rainbows with messages of hope to frontline workers here specifically at Elmhurst Hospital. And in exchange for them dropping off a picture of a rainbow, we gave them a bunny pop. Our goal was to collect 100 rainbows. We collected 315. And if you just take a few steps outside, you will see on permanent display the rainbow of rainbows that was created here as a result and a testimony to everything that this hospital did for the community during the height of the pandemic. We are forever grateful for everything that was done here. We donated Harvey, our 25-pound bunny who retails at $1,000. No one has bought him yet. And he, served as a symbol of hope here at Elmhurst Hospital 3 years ago. And as a result, we are now donating him here every year. As a result of everything that happened during the pandemic, I am beyond honored and privileged to call Suzanne Bentley my friend. She is now the Chief Wellness Officer here at Elmhurst Hospital, and that position was really created out of the need here after the pandemic to serve all of the frontline workers. Our mission is to spread hope and joy through the magic of chocolate, and we are beyond privileged that we have been able to do that here with you at Elmhurst Hospital. Finally, I want to just thank Atia and Helen and Susie for giving me the opportunity to join the Elmhurst Business and Arts Council, and we continue to look forward to all the ways that Eigner Chocolates can bring healing and help Elmhurst Hospital and the entire community here in Queens that you serve. Thank you.
Thank you for your comments. Thank you. Our next speaker is Anthony Sama, the Administrator for Flushing Meadows Corona Park and the Executive Director for the Alliance for Flushing Meadows Corona Park. And after that, Raga Hossein.
Good evening, everybody. Thank you for having me tonight. I want to say a special thank you to Chief Executive Officer Helen Ortega Landaverde and Atia Butler, Director of External Affairs, for inviting me to be here this evening. Again, my name is Anthony Sama. I'm the Administrator for Flushing Meadows Corona Park, as well as the Executive Director for the Alliance for Flushing Meadows Corona Park. For those of you who might not be familiar with the Alliance, as we are still a relatively young organization, only in our 7th year, the Alliance's mission is to help support the New York City Parks Department in the beautification, stewardship, and programming specifically for Flushing Meadows Corona Park. Though I'm relatively new to this role, I've been at parks for 14 years, and so I can speak for so many of us who saw our parks play an integral role in the health and well-being of our city's residents when they needed it most. With regard to both physical and mental health, New York City Parks and the Alliance for Flushing Meadows strive to provide a safe space for our city's residents to recreate and find respite from the urban landscape of New York City. Elmhurst Hospital has not only worked to ensure we are provided with the best health care available, but has proven to be a great supporter of this integral green space so many look to as their backyard. We are continuously hearing about how our New York City parks served as the lungs of our city. Someone earlier referenced Elmhurst Hospital as the heart of our city. And so since the beginning of the pandemic, even as the impact continues to be felt, we look to important partners such as New York City Health and Hospitals to stand by us and advocate for support from our communities and elected officials to strive for more, not settle for less. The Alliance for Flushing Meadows Corona Park thoughtfully recognized Elmhurst Hospital at our gala, known as the Evening Under the Sphere, last October for their tireless efforts in providing great care to our community in some of the darkest hours we have had to collectively overcome as a borough and city. It is support like theirs that makes the Alliance's programming not only possible, but successful and enjoyable for the thousands of people annually we support through our fitness programs, educational programs, cultural events, and celebrations, all of which serve to enhance the health and well-being of our neighbors. We look forward to continuing our partnership as we develop our programs for the future and hope we can further support Elmhurst Hospital in their work to keep our city healthy and strong. Thank you once again, Helen and Atia, and to all the staff in Elmhurst Hospital for their tireless efforts, daily sacrifices, and especially over the last 3 years. Thank you.
Thanks so much for your comments. Next speaker is Raga Hossein, Community and Government Affairs Liaison for Live On New York. And after that, Jalitza Baez.
Hi, my name is Raga Hossein. I'm the Queens Community and Government Affairs Liaison for Live On New York, the federally designated organ procurement organization for the greater New York City area. I want to say that it's been a pleasure working with both Elmhurst and Queens hospitals in promoting organ donation. You guys have done excellent work in terms of drawing up support amongst your staff and raising awareness among the general public. I just want to say also, thank you again for doing everything you can during the pandemic and for servicing the diverse communities of Queens. So, in the midst of tragedies, families are asked about organ donation, and they say yes. They say yes to having their loved ones leave legacy. And in the process of saying yes, and during the midst of their tragedy, someone else gets renewed hope. They get a life-saving heart, liver, kidney, lung transplant, and none of that could happen without your staff doing everything that they can to make organ recovery and transplantation possible. So thank you again. As far as what Live on New York is doing and our community and government affairs team, we're out into the community now that the weather has improved. Where we're doing more fairs, more tablings, we're doing more education in terms of how organ donation works, encouraging people to enroll, as well as dispelling some of the many common urban legends. My team is present at both Queens and Elmhurst Hospital. We're going to be at Elmhurst later on, so please definitely come join us on Monday when we're going to be tabling. And thank you again. We had a record-breaking year. We saved more lives than ever. And again, that was through your hard work. Yes, please clap. The people had their lives saved. They had a new lease on life with their new heart lung. They could do activities that they weren't able to do before, enjoy more time with their families, as well as tissue donation, getting corneas, skin grafts, heart valves, so many things done to improve their lives. And again, none of this could happen without your stalwart support. So thank you again for everything that you do.
Thanks so much for your comments. Next speaker is Jalitza Baez, Healthcare Services Outreach Coordinator for Voces Latinas. And after that, Lance Furtado.
Hello, saludos. My name is Jalitza. I am the Healthcare Service Outreach Coordinator at Voces Latinas. Right here is my boss, Natalie, and Derek. Hi. So we at Voces Latinas, we're right around the corner. And during the pandemic, we have been able to test and vaccinate with health and hospitals, over 3,800 individuals in our community for COVID-19 and Western Queens overall, as well as for the last 3 years, each year, we've been able to connect roughly around 1,400 members or community members to NYC Care. And I share these numbers because it is very important for me to come here and say thank you to health and hospitals for opening this type of service to our communities. We've had clients that didn't even know that they didn't think that they deserved to have the privilege to have care. And that's very scary. And, NYC Care, Health and Hospital has been a light. But of course, there are challenges, and my job here is to advocate for the individuals that also come to health and hospitals, Elmhurst to be exact. For starters, the process to connect to NYC Care through the financial counselors here at Elmhurst Hospital often takes very, very longer than in other hospitals. And it's difficult, obviously, for us because we are in Jackson Heights, Elmhurst area. So a lot of our clients are in Elmhurst. Another difficult situation is when our clients really work hard to get here, and aside from the hard times of the difficulty of getting here because of the language barrier or transportation. They come here, they might be in crisis, and it's like, okay, you don't have one piece of paper, we can't finish the application, come back in 3 weeks to finish the application. And that's really difficult, especially if you're in crisis, right? If you need these documents and you lost your wallet or something like that, right? It is difficult to find an appointment. And being here kind of tells us that it's because there's not a lot of staff. But it's very difficult for a new patient. And even for appointments for specialists, for gynecologists, ophthalmologists, mental health appointments, and cardiologists may take up to 4 to 6 months. Also, bilingual mental health providers and with cultural humility are a big necessity, just because they make all the difference. Honestly, it's the way you say things, And some recommendations, of course, because we're not just going to throw this at you and leave it in the air. Well, for starters, we think that the increase of dental coverage in NYC Care would be a huge benefit for our clients, our community members. Also, partnering with the pharmacies in the community would decrease the wait period at the pharmacy here. And if you need a list of potential pharmacies, we work with a lot, so let us know. And also allowing financial counselors to be at community-based organizations, like based in community organizations, where they can see our clients, and us as navigators, we'll help them get the paperwork quick because we know how to say the things, right? So maybe having the financial counselors in our agencies will make a big difference as well. So yeah, thank you so much for opening this floor, and thank you for listening. All right, have a great night.
Thank you so much for your comments. The next speaker is Lance Furtado, Executive Director of Kings of Kings Foundation. And after that, June Balloon. Okay, all right, then go right ahead.
Everyone. My name is June Balloon. I thank you for this platform, Dr. Katz, and your executive board, and mostly your Village of Healing Hands. On a personal note, I was here about February and was able to finally, after the pandemic, get a colonoscopy. And I thank you for the anxiety that I've had and the paranoia, and I was awarded a clean bill of health, so thank you very much, your staff. Okay, I'm here today because I'm Director of Marketing, Fundraising, NFL sports events, special events at Rosedale Jazz Football, which is a youth program, one of many, but we are one of the top in Queens. We serve our community over 60 years, so we here existed in 1961. And I played as a child. I'm still in the community, so I feel the obligation to give back my community, continue. So I've been doing that for over 20 years now. The reason for me being here today, I'm here representing, I'm not much of a speaker, I'm just a doer, I get things done most I can. Representing my president, Jacques Leandre. So what I like to say is the partnership that we've created with Queens Hospital alumni, my high school alumni, Christopher Roca was there, and now I believe is Neil Moore. But the assistance of Cleon Edwards and Sandra Springer was able to grant us assistance, things like donations to our awards win dinner. We do black tie gala award dinner to celebrate the excellence of the past season. So we were able to get funding to do things like merchandise with the NYC Health Hospital Queens logo on it, to do cross-marketing. It's not just about giving us money, but cross-marketing, also giving awareness to the hospital as well, was tremendous to us. One thing about Rosedale Jazz Football, we are a high school preparatory program, and I guess we feel like we're like the Catholic School of Sports, if that makes sense at all. Because the last thing we teach is sports, is discipline. We have over 350 young men and about 75 to 100 cheerleaders, and they win championships. We have a championship program willingly as well, but our academic program. Kids can't play if they're not doing well at school. We have coaches that go to the schools, surprising, because we're in an age and era that we have grandparents that are bringing their kids to practice and stuff like that, little flip-flops and stuff like that. It's hilarious. But it's fun, it's amazing, and we serve between 6 to 13-year-old, and we have all the top high schools that come to us. What separates us is that we have relationship with NFL players, because my background comes from music. I worked at Bad Boy Entertainment with Diddy, Puffy Combs, whatever your name you know him by. I was in promotions, and so that's my background. So I know from there, and I worked at Cash Money Records, so it was fun. So we joined it together to keep it fun for the kids and keep them focused, to stay focused in education. And if they happen to be after we have about 3 kids that's actually gone to the NFL. And so the reason here today is that I would like to continue the partnership that we've had built with NYC Health and Hospitals to continue us fundraise. And there's so much overhead going to camps. We have a camp that no one else does, upstate New York. We take the children late August and go to camp, which is 4 days, 3 nights. And kids that were home, peeing in a bed, come home, making a bed, not peeing. So it's just still stopping, still men grooming men is our goal. And I just pray that you continue to fund us. I'm glad that we were blessed enough that our elected officials, Borough President Donovan Richards, awarded us a $1.3 million football field during COVID, and my 31st District, Sylvina Brooks Powers, Councilwoman, was able to oversee and make sure that that money didn't get lost. So we celebrated having a brand new field last year. So that's wonderful. Brand new field, bleachers, and water for the children to drink and hydrate. So now she's helping us get a comfort station. Right now we're doing porta potties. We have to fundraise for everything. So I'm about to leave and get out of the way, but I just pray that y'all continue the partnership with Rosa Just Football so we could continue to serve our community. Thank you.
Thank you. Thank you very much for your comments. Next speaker is Ravi Rampal, First Vice District Governor for the Brooklyn and Queens Lions Club. And after that will be Caricia Batan.
Hello, good evening, everybody. Thank you for hearing me. I'm speaking on behalf of the district governor. His name is Romeo Hitlal, but I'm also speaking as a Lions Club member and a employee of Queens Hospital. So underneath the leadership of Neil Moore, he has leveraged our employees at the hospital that are in community humanitarian groups to further and actually maximize and target how the humanitarian effort is actually given to our population. So underneath that, by the strategy that we used, we started our partnership in September of 2022 with one goal in mind, is that to strategically direct humanitarian efforts of the Lions organization to target community health needs for the most underserved populations. And how we did that was by aligning the actual missions of Lions Club and then aligning that with the population health efforts of the hospital. So what that led to was an amazing result within the last few months. What we've accomplished is a donation of the Lions Club International Wealth Allen Retina View camera, which was a $13,000 investment. That's going to be used inside the emergency room to give patients a retina screen and hopefully get it right to an ophthalmologist and maybe prevent some type of blindness. And this is the alignment that we're talking about. So on top of that, we partnered with the community health workers who are going out into the community and actually finding patients that need medical equipment like wheelchairs, walkers, things like that. And they get that news straight to me. Then I go to the Lions Club and we get them donated directly to where we need it to be. The same thing for food insecurities. So now we connect those type of patients within the community that need food. And then we work with restaurant owners that are within the Lions Club to literally deliver meals to those families on those nights and weeks that they can't afford it. We then, I don't know if anybody saw this, but we were a part of the 2023 Pagua Parade in Little Guyana. So that was a huge success. We were able to get hospital staff members to celebrate with the community about diversity. And we really made a name for ourselves in that neighborhood. And following up the upcoming project was we're working on a health fair, and we're going to use our community's health assessments from New York Health and Hospitals and our population health management dashboard to open up kind of educational and pre-screening services within our community and hopefully direct and educate people on how to access those services at the hospital. So it's been a great 6 months, and we look forward to continuing that project. So yeah, that's about it.
Thank you very much. Our next speaker is Caricia Batan, founding director of the Queensboro Dance Festival. And after that, we will hear from Nuala O'Doherty.
Hi, everyone. My name is Carisha, but Caricia sounds great too. I respond to that as well. Depends on what culture you're from. It's also Caricia. So I'm Carisha Batan. I'm the founding director of the Queensboro Dance Festival. Before I talk about our program and express gratitude for our partnership, I want to really shout out, after listening to all this testimony in our community, I want to shout out the nurses because I'm a new mom. I was a high-risk pregnancy. It was scary. And to be honest, the most that I saw were the nurses, not the doctors. They were hope. They were reassurance hour by hour. So I want to thank the nurses, and I hope whatever negotiations are on the table, you guys really listen to them because they really are the lifeline. I'm also a Sunnyside resident. I'm part of Community Board 2. Elmhurst Hospital is the closest hospital to me and my brand new baby, especially with the lack of maternity services in our area. This hospital is so crucial, not just during the pandemic, but also for maternity services, as I'm very quickly learning. Aside from that, I wanted to thank you. I wanted to thank Atia. I wanted to thank Clara for their support of the Queensboro Dance Festival. We provide free and outdoor programming, presenting only Queens-based dance companies. We've done programming right outside the hospital. We do programming in in Diversity Plaza, down the street, as well as along 34th Avenue in partnership with the 34th Avenue Coalition. Thank you, Nuala. And Travers Park, thank you to the parks. So I wanted to just acknowledge, thank you guys so much for realizing, especially during the pandemic, that arts and culture is a holistic part of the overall well-being of people, especially during the pandemic. Coming into the hospital as well, for my first time at Elmhurst Hospital a couple years ago, it was scary, but it just so happened that day, there was a live band playing in the lobby, and that immediately brought comfort, relief. It felt really nice to feel like this hospital has a wide view of what it means to take care of people, not just medically, but also emotionally and mentally. And I got to see the art and the art display that was along the hallway. So I really do see how Elmhurst Hospital really looks out for local organizations like mine, and how it serves the community in alignment with your services here. So I want to thank you for the partnership. Thank you for the recognition of our Queens artists. Many, many, many of our artists live right here in Jackson Heights. Actually, some of our dancers are also nurses here. So it's a very meaningful partnership to us. And we thank you so much for your continued support. And we look forward to deepening our partnership in future years.
Thank you so much for your comments. Next speaker is Nuala O'Doherty from the 34th Avenue Open Streets Coalition. And after that, Cruz Torres Cano.
Good evening. Thank you for staying and listening. I really appreciate the chance to speak directly to you. As a neighbor, I think it's really important you understand how important you are to this community. I don't know if people tell you that all the time, but you're really an important neighbor, and we appreciate you being a good neighbor. A big shout out to Atia, who is always answers her calls, and whenever you need help, I'll give you an example. I worked on a neighborhood problem. We had a big, huge fire 2 years ago in which an entire block almost burnt down, and we had 370 families made homeless from it. And in that emergency, at 9:30 at night, after the fire is still blazing, all these people were pulled out of their homes without their medication. And a simple phone call, right, to Elmhurst got a pharmacist on the phone, and someone ran over to Elmhurst Hospital and got emergency medicine for families in 30 minutes. That's what a neighbor does, and we appreciate it. I am not here because Queens Hospital saved my mother's life. I am not here because by the time when I drove Jim Burke here, when he was having his heart attack on 34th Avenue, before I parked my car, he was already in emergency surgery. I'm not here because I actually go to Gotham Roosevelt and get my own care as well as my family members. I'm here because 3 days a week, I work with our newest neighbors, and that is the 50,000 new families who have immigrated here. And these newest neighbors have suffered great trauma. Many of them have walked here from Venezuela, Colombia, Ecuador, Peru. I often look at them and they show me their IDs, and on their IDs, they're 40 pounds heavier 3 months ago when they left on their journey to get here. And when they get here, they've suffered such great trauma. And they are so happy to be here finally. And a huge resource for them is Elmhurst Hospital. And I want to make sure you guys know that I always tell them, I said, don't worry, just all you need to do is go to Elmhurst Hospital, they'll take care of you. And we really appreciate that. But I do have to point out that I am so happy that you have over 200 social workers. I know everyone loves nurses. I love nurses. But I want to talk about your social workers and how important they are, because many of these people are fighting in court for the right to stay here and seek asylum. And Elmhurst Hospital is one of the best testimony they can get, is that letter from the doctor talking about their trauma and the help they get here. And we really appreciate that. Unfortunately, I should point out that I called earlier this week to make an appointment for someone to see a bilingual therapist, and I got an appointment, thank you, in December. And so people suffering that great trauma really need to get some services, and we appreciate you offering them, but it's a huge void. There have been 50,000 new immigrants coming here, and they're all looking for your help. And I'd like to know how to work with you to advocate so that we can get more services, hopefully provided through you, to get them the mental help and therapy they need, which you guys have always supported, done wonderfully with. But having 6 months wait times are just really hard to work with. But I'd also like to say that I'm a community board member in Community Board 3, right across Elmhurst Roosevelt. And we deal with lots of different organizations that come in, LaGuardia Airport, the Met Stadium, the USTA. And so when you deal with these big organizations, there's always this kind of confrontation. But when you deal with Elmhurst Hospital, they're just so friendly. We just really appreciate it. There's just this niceness of being a good neighbor. And I think it's that because you're really deeply rooted in the community, you're not an other, you're just one of us. And that really shows in everything you do, and we really appreciate it. So thank you so much.
Thank you so much for your, thank you. Next speaker is Cruz Torres Cano, advocate and organizer for the 1199 Education Project. And after that will be our last speaker, Franklin Wilson.
Yes, good evening, everyone. My name is Cruz Torres from Healthcare Education Project. It's a community-based advocacy organization. We work in partnership with individuals, healthcare providers, and civil and religious leaders in neighborhoods. And to protect access to critical healthcare service, better understand the urgent healthcare issues facing our communities. Education and prevention is our mission. I would like to talk Spanish because this is my native language. I have the permission to explain that. I would like to say, me gustaría decir gracias, Dr. Katz, gracias a nuestros partners, gracias al staff del Hospital Elmhurst por ser el primer hospital durante la época de la pandemia de pensar en nuestras comunidades nativas, en nuestras comunidades indígenas, originarias. Bueno, esas comunidades más vulnerables fueron las más olvidadas durante esta pandemia. Por esa razón sucumbieron ante la crisis COVID-19. Estas comunidades no están incluidas ni siquiera en el censo distrital. Y gracias al Hospital Elmhurst, nosotros seguimos luchando para poder solucionar la brecha de Medicaid. Gracias al Hospital Elmhurst, en nombre de Clara Londoño, de Nancy Polo y de todo el staff de Helen Arteaga, con quien trabajamos tantos años y disfrutamos de su liderazgo en la lucha de superar estas inigualdad. Tanto hemos hablado de la discriminación, de la disparidad, de la inigualdad, y cuando seguimos después de la pandemia, quizás no solucionamos este problema. Pero yo tengo que decir gracias al Hospital Elmhurst, porque desde febrero nos han facilitado las puertas de este auditorio para atraer comunidades vulnerables para educar en salud mental post-COVID. Hemos estado trabajando con la comunidad latina, con los organizadores líderes de las diferentes organizaciones, con el Departamento de Salud Mental y de Mental Health First Aid Training, y con comunidades como las familias inmigrantes que están llegando, igualmente con familias con miembros en necesidades especiales que también fueron olvidadas durante la pandemia. Muchísimas gracias por no ser parte del discurso de post-pandemia de la discriminación, de la inigualdad. En forma silenciosa se está haciendo esta acción. Estamos trabajando, menciono a Voces Latinas, la preocupación de Natalie Rubio de poder incluir y trabajar con las comunidades originarias, especialmente Corona, Elmhurst, Jackson High. Corona es donde se centra más la comunidad vulnerable, y superar las barreras de lenguaje. Por esa razón estoy usando el español como un símbolo de seguir superando esta brecha de comunicación si queremos hablar de una salud pública justa, inclusiva y para todos por igual. Muchas gracias. Buenas noches.
We have one more speaker after Franklin Wilson, who is the Assistant Director of Prevention Youth Services, Elm Corps Youth and Adult Activities. And after that will be Elia Ruby, who will be our last speaker.
Greetings, everybody. My name is Franklin Wilson. I'm with Elm Corps Youth and Adult Activities, Inc. I work holistically with youth and young adults. We are a substance use facility where we work with inpatient, outpatients within our community. We find out that there are a lot of things that are happening in our communities that are why I'm here today, that we are trying to figure out and create opportunities to collectively work in unity with one another. Just not too long ago, I had a conversation with a young man. He had to be about 17 years old. This young man said, "Hey, I do not have faith in the healthcare system in this community." And truth be told, there's a lot of our youth that feel that exact same way. With that being said, we have created a coalition called the Queens Prevention Community Coalition that meets every fourth Thursday of the month, where we can be able to collectively give information and insight to these young people about the resources that are happening in our community. I see a lot of our allies in the room. We have Common Point. We have Voices Latina. I met with Voices Latina, I want to say, maybe not too long ago, and we had a conversation with them. But I'm going to tell you, this is what power looks like. The ability to be able to work together, to come together, to figure out how we can create solutions for the issues that are happening in our community. And I'm here today to stand with you to let you know that we do need your voices. We do need to know exactly how can we collectively work together to where we can mobilize, optimize, and stabilize our communities. With that being said, I do yield my time. Thank you so much, but we do need your help. Thank you.
Thank you so much. Our last speaker is Elia Ruby. So with that, I guess we have concluded our program. Thank you so much for everything that you've contributed tonight, and please get home safely.
Thank you.